Well, Mr. President, the debate has now begun, really, on, the bill that we call our health care reform bill. It's taken us a long time to get here. A lot of hearings, a lot of markup, a lot of public discussion, a lot of town meetings around the country. And now we're at the final pivotal moment, an historic moment in the long march to pass meaningful health care reform. And I say long march because it really started with Theodore Roosevelt and continued on through the New Deal, continued on to Harry Truman's administration, and on to this time. Every time we've been turned back by the status quo forces, those that just want to stick with what we've got, those who were afraid of making changes. Well, this time they're not going to stop us. This time it is unstoppable. We have come this far and we're not going to turn back. Now, just listening to a little bit of the discussions on the Republican side today and sort of listening to what the Republicans have had to say about health care reform in the last few months and anticipating what we'll hear from the Republicans in the next few weeks, it will be a message of fear that somehow, by changing the status quo, the American people are going to be worse off than they are now. That somehow we're going to take away something that they have. That somehow, that if we just stick with what we have, everything will just be fine. But you'll hear a lot of words and messages from the Republican side meant to frighten people, to put a pall of fear over what we're trying to do. Well, Mr. President, the really frightening thing for the American people, the really frightening thing is if we do nothing, if we stick with the status quo. Too many people in this country have no health insurance whatsoever. Thousands every day in this country, every single day, thousands of people lose health care insurance coverage. So many people who have pre-existing conditions cannot get coverage at all. People who are beginning to retire, but they're not quite 65, they can't get onto Medicare, they're left in a kind of a state of limbo where they can't get health care coverage. So many people in this country are being discriminated against in health insurance because they're a woman, or perhaps because they're older. Perhaps they're a person with a disability. For a variety of reasons, they're being discriminated against in health insurance coverage. And so we have to make these changes. We cannot continue to spend over $2 trillion a year and still be so lacking in the essential health care services for the people of this country. We spend twice as much in this country on health care as Europe. Yet we have twice as many people sick with chronic illnesses. Well, that doesn't seem to make sense. We have some of the highest tech medical devices and procedures and interventions anywhere in the world. And of course, people who have a lot of money in other countries, we always see kings and princes and wealthy people from other countries, they come here. They come here for the very high-tech, high-cost interventions. And we're very good at that. We're the best. We're unequaled in that. But where we fall short is in helping the very broad mass of American people to have the peace of mind to know that if something happens to them, if they do get ill, they're not going to lose everything. The single biggest cause of bankruptcy, I know in my state of Iowa, and I think in most of the country, the biggest single cause of bankruptcy is because of medical expenses. Because people bump up against lifetime caps or annual caps, they can't make it, and declare bankruptcy. No other country of the world, in no other country of the world, is this allowed to happen. So, it's incumbent upon us to get this bill through. At the beginning, I really want to salute our Majority Leader, Harry Reid, for what he has done. We had our bill that came out of the committee that I'm now privileged to chair after the untimely death of our esteemed colleague and friend, Senator Ted Kennedy. Our Help Committee bill came through under the great leadership of Senator Chris Dodd. We passed it on July the 15th. And then the Finance Committee, under the able leadership of my friend and classmate, Senator Max Baucus of Montana, they did their work. And then the two bills had to be put together, and that was done by the Majority Leader. And he did a masterful job of putting the two bills together and getting it down to the Congressional Budget Office and getting a score on what it would cost and what it would cover. And when we saw the bill come back, the bill that we now have in front of us, the so-called merged bill, it truly is a work of genius by the Majority Leader. I said the other day, that he has the patience of Job, the wisdom of Solomon, and the stamina of Samson to get this job done. And I also salute all the senators, Democrats and Republicans, whose ideas are incorporated in this bill. It is a robust bill. It went through a long bipartisan process. In our committee, we had 13 days, 54 hours. Republicans were full-fledged participants. They offered 210 amendments. We accepted 161, many of them making substantive changes in the bill. A similar open and inclusive process was followed in the Finance Committee. And I dare say that when we got our bill through, after all of that, after all the amendments offered and accepted or adopted that were offered by Republicans, not one Republican would vote for our bill. Not one. It's truly unfortunate that now that we've put these bills together, we've gone through this long process that has taken most of this year. It's unfortunate that Republicans have now chosen a path of delay and filibuster and obstruction. Now, why are we even here today? We're here because the Republicans are trying to prevent us from even bringing the bill to a floor for debate. How many people in America know that? The reason we're here is because the Republicans don't even want to bring the bill to the floor for debate and amendment. Well, that's their right. Under the rules of the Senate, it's their right. They can filibuster, they can delay, they can obstruct, they can say no. But just as surely as that is their right, it is our responsibility as Democrats to move this bill forward. I would remind my colleagues on the other side of the aisle that last year voters overwhelmingly voted for Barack Obama to lead changes, to make changes. And one of the changes he campaigned so hard on was changes in the health care system. And just as surely, voters elected Democrats to majorities, big majorities in the House and the Senate, to do the same thing. So it's our responsibility to lead. And that's what we're doing now by bringing this bill to the floor. We're taking another giant step towards fulfilling the mandate that the people of this country gave to President Obama and the Democratic Party last November to undertake a comprehensive reform of America's health care system. And as this, not only the long debate has made clear to the American people, but just innately, the American people know and they understand that the current system is hugely dysfunctional. It's wasteful and it's abusive. People are aware of the abuses that have become standard practice in the health insurance industry. Denied coverage because of pre-existing conditions. Health insurance being dropped because they get sick. Their insurance premiums jacked up 100%, 200% in a year simply because they had an illness. People know they can be charged higher rates simply because they're women. We know. We have the data. Woman, man, same age, same occupation, same status. Woman's charged more than a man for the same policy. Or they can be charged more if they're older. We know about annual caps and lifetime caps I just mentioned that cause people to go into bankruptcy. I think the bottom line is this, that every American family knows that in many cases they are one illness away from financial catastrophe. It is, if you want to talk about fear, that's what people are afraid of. Not so much of getting sick. I mean, that's part of life. But the fact that that illness will drive them to financial ruin. They won't be able to have enough money to take care of their kids, to send them to college, or to take care of themselves in their old age to supplement their Social Security, because the money will be used for an illness. As I said earlier, 62% of U.S. bankruptcies are linked to medical bills. And what's really the kicker in this is that 80% of those were people who actually had health insurance, but they ran up against their lifetime cap. Abuses by the health insurance industry because they can do it and they can get by with it. Think about it this way. Health insurance companies employ armies of claims adjusters who routinely deny requests for medical tests and procedures. Now, why do they do that? Because they get bonuses by saying no to the policyholder. Think about that. So as an insurance company says to their claims adjusters, we'll pay you more the more people you deny. What a system. What a system. It's outrageous. It's intolerable, and we can't afford to let it go on any longer. And one of the many things we do in this bill is to crack down on these health insurance company abuses in a very strong and robust way. Again, I deeply regret that our Republican colleagues refuse to join us in this reform effort. They have chosen to defend the status quo, protect the insurance companies and their profits over the health of the American people. Indeed, my friends on the Republican side and the health insurance companies are now joined at the hip. Same talking points, same distortions, same untruths about this bill, same bogus cooked-up studies, the same determination to obstruct and kill any health care reform effort. As I said earlier, this time they will not succeed. The more the American people learn about this bill and what's in this bill, the more they like it, and the more they're demanding that we get the job done. President Obama pledged that we would do health reform and not add to the deficit. Well, we've done that with this bill. The Congressional Budget Office says that this bill will actually reduce the deficit by $130 billion next year, and by $650 billion in the year thereafter, and in the next decade, $650 billion, and will reduce the deficit continually every decade thereafter. So all the budget concerns have been put to rest. Now we can focus on what's in the bill. The Congressional Budget Office says that our bill will cover 94% of the American people. 94% will now be able to have the peace of mind to know that they have health insurance coverage. Our bill says that if you have a health care plan that you like and that you want to keep, nothing will disturb that. Nothing. You can keep whatever plan you want if you like it. Now, a lot of people say, well, you know, this plan doesn't go into effect until 2014. Well, it does take some time to get these exchanges and things set up, but there are some immediate things that will happen next year. And the American people ought to know what that means. For example, our bill right now would ban lifetime and excessive annual limits on coverage. Next year, not 2014 or 2015, next year. Think about that in your own policy. Your policy, I guarantee you, has some kind of lifetime cap or annual caps. Next year, they won't be able to do that any longer. Our bill bans rescissions. What that means is that right now, so many people know that their health insurance policy can drop you. There's a clause in it that says that when you're up for renewal, they can drop you for any reason. And the reasons they use is if you get sick. Think about that. I can't tell you how many people I've talked to in my state of Iowa who have come up to me and they've said, especially during the town meetings and stuff that we had this summer, people come and say, you know, I like my health insurance policy. I got a good health insurance policy and I want to keep it. Well, my rejoinder was fine. That's okay if you have it, that's fine, but I just want to ask you a couple of questions. What is your lifetime or annual cap? Most often, people would say, well, I don't know. I said, well, do you have a lifetime or annual cap in your bill, in your policy? Well, they weren't certain. I said, well, do you have a rescission clause in your policy? And I can tell you 100% of the people I've talked to said, what's that mean? I said, what it means is that if you get sick, if you have to have a kidney transplant or you get cancer or heart disease, can your insurance company drop you when your policy comes due with no explanation whatsoever? Well, they didn't know. I said, well, you got to look at your policy and find out, because most policies have those rescission clauses. So I dare say, Madam President, that when a lot of people say they have a good health insurance policy, the answer is yes, they do have a good health insurance policy as long as they're healthy. As long as you're healthy. Once you get sick, out the window it goes, because you've got a cap, either a lifetime or an annual, or you've got a rescission clause. Now, the other thing I hear from a lot of families is, you know, my kids were covered when they were in school. They're now out of school. They haven't quite gotten a job yet, and I can't keep them on my policy, and it costs a lot of money to put them on a different policy. Well, our bill says now you young people can stay on their family policy until they're age 26. This is a huge benefit to working families. Now, I've said many times that the two biggest winners under our health care reform bill are small businesses and the self-employed. Small businesses. Now, we're in a deep recession. We want to get out of that recession, we better start focusing on small businesses, because it's small businesses that create over 65% of the jobs in this country. Yet small businesses are thwarted in their effort to expand and grow. And one of the biggest reasons is because of the cost of health care for their employees. So many small businesses now have dropped health care coverage for their employees because they simply can't afford it. Or the premiums have gone up, the deductibles are huge, and basically what it's gotten to be is just basically a catastrophic coverage for their employees. Small businesses need help in order to grow and expand and get us out of this recession. This bill will provide immediately next year up to 35% tax credit for health insurance policies for their workers. That is a big deal. And it's not just for small businesses, it's for my farmers and for self-employed, so many self-employed in this country. Next year, up to 35%. And we're going to have next year a new policy option for people who have pre-existing conditions. So if you've had an illness in the past, if you've been living with cancer and you've got it under control, you have a chronic illness, we're going to provide next year a new policy option to put people like that into a high-risk pool and to provide that they can get insurance coverage at prices they can afford. Now, when the exchanges come on in 3 years, all of that will go by the wayside. They will not be able to discriminate because of pre-existing conditions. But next year, right away, people who have pre-existing conditions can get policies at prices they can afford. How many times do I hear people tell me that, you know, here I am, I've been working hard, I've been a construction worker or something like that that's hard work. I'm 55, I've had some accidents, I've got a bum leg and my back is bad. I can't work till I'm 65. But what am I going to do about my health insurance? Well, we have in here, starting next year, if you're an early retiree, we have a program to protect your coverage. At the same time, reducing your premiums, both for you and your employee, till the time when you get to be age 65. This is a big deal for so many people in this country. Lastly, Madam President, in whatever time I have left, parliamentary inquiry, how much time does the senator from Iowa have left?
37 minutes and 13 seconds.
We have Senator Conrad, who is here waiting to speak. So whenever you're
As I understand that my friend, the senator from North Dakota, wishes to speak, I will wrap this up by saying that there's one other part of this bill that's so important, that doesn't get much play, but I consider it to be one of the most significant parts of this bill, and that is a huge new emphasis on prevention and wellness, keeping people healthy in the first place. There's a lot of talk about bending the cost curve and how we're going to bend that cost curve and get costs down. I submit to you not only the best way, but perhaps the only way that we're going to do this is by keeping people healthy in the first place, putting more emphasis on prevention. I've often said we don't have a health care system in America, we have a sick care system. If you get sick, you get care. Almost all of our expenditures go for interventions and patching and fixing and mending once somebody gets sick. Very little goes for prevention. About 96, 97 cents of every dollar goes for taking care of you after you get sick. Only about 3 to 4 cents goes for prevention. It's time to do more of that. Time to do more for prevention and wellness, and keeping people healthy in the first place. So in this bill, we have in there a provision that says that if you want to go in for your annual checkup and your annual physical and your annual screening, no copays, no deductibles. And for certain other screenings like colonoscopies and breast cancer screenings and things like that, no copays, no deductibles. Now there's a lot more in the ensuing days and weeks when we debate this. I'll be talking more about the prevention and wellness part of this bill. It is big. It's the first time we've ever done anything like this, to begin to move the paradigm in this country away from sick care to health care. Our goal with this bill and with this provision is to change America into a wellness society where it's easier to be healthy and harder to be unhealthy. Just the opposite of what it is today. It's easy to be unhealthy in America today, hard to be healthy. We're going to change that around, and we're going to start with this bill. One of the most important parts of this bill is the massive change that we're going to make in prevention and wellness.